Well, hi guys. My name is Audrey. It's nice to meet everyone. Savannah was gonna do this, but I took over because she had a meeting. So I'm excited, but also interested in learning what you guys have to say. So I have the first questions. I have question number one. Can you tell me and the listeners about Mile High Health Care and the different programs?
Sure, Mile High Behavioral Healthcare. And good morning. I'm Bob Dorshimer, the CEO of Mile High Behavioral Healthcare. Mile High has been around for 65 years. We were one of the first incorporated nonprofits to really specialize back in the day when it came to addiction disorders. And through the years and through the growth of the industry and as the behavioral health industry really took off, Mile High continued to expand and do some really amazing research, really innovative research, and really grew its programs for families, adolescents, and children. So Mile High has a couple of really core competencies that I think is really important. So we specialize in gender specific services for women, which is our Miracles program. We also specialize in residential treatment for substance using women that are ready to deliver clean and sober babies. So that's a very powerful program when someone reaches that point in their pregnancy saying, I just got to get a hold of this addiction and I want this baby to have the best chance. And it's an amazing residential treatment center. And the success is very amazing for our women and newborns at the Aspen Miracle Center. And then we specialize in LGBTQ plus, and the acronyms continue to grow. So I like to call it the Rainbow Coalition. So we specialize from providing HIV and preventative care to substance use and mental health disorders to gay men. We operate the Transgender Center of the Rockies and all-inclusive program there as well. We specialize in a medication and prevention program called PrEP. And PrEP is a revolutionary medication that stops the transmission of HIV, which is absolutely amazing. And we just continue to provide those wraparound services to our Rainbow community. And then we have really strong strengths in reentry and problem solving courts. And problem solving courts are where you've decided to go a different route in the justice system and to work in a clinically driven court system. And we're part of many different metropolitan area problem solving courts. So pretty strong reentry program that we're known for. And then lastly, we really believed pretty extensively with people with lived experience. So that's our Transcend program. We hire many of our graduates back, and our Transcend program is individuals with a lived experience, and they wrap around our clinical cases and kind of give our organization as a whole one big recovery hub. And generally, they are our graduates. They are people that are very passionate about our core beliefs. And so we're very excited about our Transcend program is the name of that. And then lastly, we provide the emergency shelter for underhoused families over on the Anschutz Medical Campus. So we operate a emergency family shelter and an emergency family shelter for cold weather.
Wow, that is incredible. I love what you guys do and all the work that comes along with it. That's just inspiring to me. I like how you can all take this beautiful group and then turning into something better and help people's lives as well. I love it. I never knew about that. So thank you for sharing that.
No, we really, there's many organizations that do a lot of things. And what Mile High really wanted to do was really specialize in our boutique buckets of care and really do them really well. So those are, some really strong programmatic areas for us that I just described to you. But we really believe if you can hone in your organization, your clinical team, your patients, and all come together with the same mission, only good things come out of your treatment plans and your recovery process.
Yes, definitely. Wow. That is great. I love that. Thank you.
Mhm.
For question 2 I have down is, what services does Mile High Behavior Health Care offer for youth in crisis or experiencing homelessness?
Yeah. Mile High has always been passionate about homeless and runaway youth, youth underhoused, youth of different diverse backgrounds, certainly our LGBTQ plus youth. I've done years of research with the federal government as to the pathways to what leads to youth and young adult homelessness. So we provide mental health, substance use, housing, liaisoning our youth. We have many different partnerships. We have a program called Hive. The Hive has a behavioral health drop-in center where any moment during the day that you're feeling uneasy or bullied or you're not understanding how different feelings are emerging, it's not just a drop-in center, it's a behavioral health drop-in center, which gives you an opportunity to meet with professionals that can really help describe what it is that you're experiencing. It's also a safe place for you to start inviting your family and saying, hey, family, I'm starting to have these feelings and I'm thinking about going in this direction. So it's also a safe place for the coming out process. I put in quotes because everyone's process is unique to themselves. So I would say we have pretty extensive care in trying to provide wraparound care for young adults all the way up to age 26 experiencing homelessness, from employment opportunities to case management to lived experience, which is our peer team, to behavioral health. And for all of our young folks, we do things through experiential treatment. So rock climbing, hikes, going to parks, mountain biking, snowboarding. So getting to where youth are, which is being active instead of just sitting one on one across from each other, isn't really what the youth and young adults, or really almost anyone that comes to Mile High. We're an experiential therapeutic organization. People really want to be doing something. So we like offering cooking classes or crocheting or yoga with goats, or let's go therapeutic horseback riding. Let's get on that snowboard and start thinking about problem solving some of these life challenging issues. So Mile High and its staff are also very active. So I would say probably pretty extensive care for underhoused adolescents, youth, and youth that are couch surfing, all these names that we've come up with to describe people, but we're definitely there to support and have been for years.
That is amazing, especially, like, you naming on all these activities as well, like, for an example, like, sitting one-on-one with somebody and talking for a very long period of time can get, like, overwhelming, but also, like, make you tired and not interested. So, like,
Mm.
I love how you guys have yoga and rock climbing, to get them involved, but to let them know that you're there and they can do all these fun activities with the support you guys offer. I'm amazed every time I do a podcast, I'm amazed by everything. Like, it's so inspiring and so love.
And you still have the opportunity to have all that closeness with your therapist. So of
Yeah,
course you can have one of those sit down heart to heart clinical conversations. But like I know personally myself, I like walking and talking, and as a dad, I'm a dad of several sons, and we like to, be outside barbecue and talking, or walking and talking, and it just kind of helps reduce the anxiety about how you're feeling or what you want to experience. So there's a time and a place for sit down one on one, but there's also a very important part about being active and being healthy. And we've got to remember we live in the best state to be active, and to really get out there and experience life can really reduce anxiety and trauma.
yes, I totally agree. Especially with walking. I love walking. It's just nice, like, having a talk and walk, and express how you're feeling. Well, this is incredible. I love how you guys share the supports and resources that you guys have. For question 3, I have down is, can you tell us about the new youth drop-in center that I've heard about?
It's a pretty neat place. We opened it about a year ago. It is a behavioral health drop-in center. So what does that mean? So it's a little different than some of the other drop-in centers that are just purely for unhoused youth, runaway youth on the move, so to speak. This is a drop-in center with intention. So schools can refer an adolescent, the adolescent can come on their own, parents, other therapists. It's a place where there's dedicated staff, washers, dryers, showers, foods, fire pits, outside grills, TVs, places to plug in your phone, places to lounge, places to talk, places to heal. We've created all these little spaces where you can just come be who you are. We have a recording studio so you can get in and listen to music and start putting your feelings to words and then matching it to a beat. We have a stage for you to do slam poetry and any type of skit that you want to do on stage and perform, all the way to fireside chats, all the way to just playing Xbox and maybe just wanting to talk to people similar to you that are going through the same feelings. Some of our kids have just gotten out of the Department of Youth Corrections. Some of our kiddos just got out of a children's hospital with mental health issues, and they're not involved in different kind of day treatments, that they want to still have supports. They come to our drop-in center and hang out with other youth that have had the same experience they've had and start building some sense of normality back for themselves instead of feeling that they're labeled broken or society that they don't fit in, or they're watching the politics, or they're reading things on their iPhone, or they've been tracked a certain way in high school or junior high. So it's been, 28 years of my career that I've really worked hard for adults and everybody in our organization really to be mindful of labels and tracking people in certain directions. So the Hive, which is our drop-in center, is a real supportive, come as you are, be as you are, and we'll see you as that. And I'm not afraid to say, just come hang out. And when you're ready, talk to us. So we have no expectations other than your safety and a safe place for you to be. And come grab a meal and hang out. Let's see where our relationship goes and figuring out what the next step is for you. So the Hive is in North Aurora, close to Montbello, Green Valley Ranch, East Denver. And it's a pretty cool place.
Yeah, that is so heartwarming how you explain what the shelter offers, but also it makes it feel like a safe place, but also home for others who feel like they have nowhere to go, but also like they can play the Xbox or they can listen to music, like do all these fun activities, but also like grill outside. It's so incredible how you explained everything so well and how the shelter can help others, even others who are there and they have the same story, like having someone to talk to about it and like they can relate to one another. So that's incredible. So thank you.
Yeah, it's a very nice day program. Come sit by the fire. And if you just want to read a book and take a break from your neighborhood, we have some kids that live in really tough neighborhoods and they want to kind of get away from the toughness and they stop by, and sometimes they just want to hang out with their friends and they're not involved in certain things that are going on in their neighborhoods. And so that it's also a place that you can come and get away. And you don't necessarily need a huge problem in your life, but it's also a place just to take a deep breath, I think. And I think that's really hard since COVID and since all the politics going on in the world right now and our school systems. I think everyone just sometimes just needs to take a deep breath and take a moment. And I think that's what the Hive's really about for adolescents.
Yeah, totally. It's nice how someone can just go in and like just chill for a moment. Just like, I need this moment for myself, like doing like a little bit of self care, taking that mental break. Question 4 I have down is, how does this program support underserved populations in the community?
Yeah, modern behavioral healthcare has always specialized in these terms: marginalized communities, underserved communities. Again, these names of labeling people that our systems do. But we have always chosen to be a Medicaid provider. So Medicaid, obviously, you need a certain amount of money to qualify for the program or not have a certain amount of money. So we really wanted to build Mile High behavioral healthcare and offer first class behavioral healthcare, just like somebody that would have a for-profit insurance plan that lives down the street from you. We wanted you to receive the same exact care on Medicaid. So we've dedicated our programs to the underserved community. All of our locations, we've moved into what is called, I guess you could say, behavioral health deserts. Of course, you hear about food deserts, which means marginalized communities don't have access to large grocery stores. All of the mom and pop grocery stores obviously got closed as the big grocery store chains came in. So we've worked very hard to position where we put our clinics. So most of our clinics are in neighborhoods that work with the underserved. Kids are on free and reduced lunch. They are Head Start neighborhoods that have strong after school programs for working parents. So we've moved our behavioral health programs into those communities. So we're in Globeville, North Denver, South Federal, East Aurora, East Denver, Montbello, Green Valley Ranch, all the way up into Summit County, which is wildly wealthy, but at the same time, the working class that's up there supporting ski resorts and the restaurants for those children and for those families. We're up there as well because the wealthy can access very fancy private behavioral health opportunities. So we're really also excited to be up in Summit County providing that care in our mountain communities as well.
Wow, I find that amazing how you guys all spread out to all of these places in Denver area that need the resources, but also like how you explained in the desert as well. You said desert, forgot the word a while. You already said the
Well,
word.
it's when you hear about food deserts,
Yeah.
what I was talking about, that's typically because in the marginalized or underserved communities, big grocery store chains really don't want to come to that neighborhood
Yeah.
because that neighborhood is either on food stamps, so it doesn't have a lot of disposable income. So the grocery stores do make a lot of money. So therefore, you find people in underserved communities having to drive or take the bus and go further in order to get their weekly their groceries, which means it's also more difficult when you're spending more time traveling, spending money on fresh produce and proteins and meats and dairy products. So I've taken that concept and have thought, well, if this is happening in the food part of our lives, what happens to healthcare and what happens to behavioral healthcare? And obviously we're a behavioral healthcare organization. So I took a look at those food deserts and I was surprised to find out there's no behavioral health. So you have to leave your neighborhood to get food. You have to leave your neighborhood to get a behavioral health needs for yourself and your family. And I just thought that was ridiculous. So we moved into those neighborhoods, and that's where our services are located today. We're spread out throughout the metropolitan area as well as our mountain community. And then if there's anything positive to say about COVID, what came out of COVID is we were allowed to finally do telehealthcare or behavioral health. We were never allowed to do that. So we use telehealthcare sparingly because we really believe in the connection of being together. But if I had somebody in Durango that really wanted to access our services because their services didn't exist in Durango, they could access us. Or if you lived on the border of Colorado and Kansas and you're 15 years old and you found us online and you wanted to join our adolescent program, the Hive, and just start that connection, that we also have telehealth care to help those that are in the mountain, rural, and frontier communities. And then we're also a very native community, and there's a lot of things that just aren't talked about in native communities. So we really want to also have young adults and adolescents and family members be able to reach out and have those private conversations. So telehealthcare has also become a very important part, which really helps the underserved population.
I totally didn't know that other youth and other people can reach out to you even, like, though they aren't in the like, resource center or, like, far away, they can totally send you an email or give you guys a call to be a part. That's incredible.
You can be in
Oh,
Dolores, Colorado, or 17 years of age and be in high school and not sure which direction you want to go. And there's not really a lot of nonprofits like us down there. And you can set up at a certain age, you can do this all on your own, reach out and get a therapist or reach out and get someone with lived experience or case management from us, or even join a virtual, just kind of community group. So yeah, we're definitely there for communities that aren't able to travel. We certainly can meet you online through Zoom and provide care to you. So we're definitely also a mountain and frontier provider, not just a metro provider.
yeah. And especially along, I heard you mention that you guys take Medicaid as well. There's a lot of youth who have Medicaid, so that's really great to have down.
Take chip as well.
Oh, wow. Yeah. Like, this is really awesome. I need to add you guys to my community mapping I'm doing because this is incredible. Like, I can spread it out, like, through every town here. And
From Keensburg, Colorado,
yes,
to Dolores, to
yes.
Ignacio, uh,
Mancos, Bayfield.
Memphis, Bayfield, to Rifle, to Dinosaur, to, so anyone finds themselves needing that connection, we're able to do that. And, we look forward to growing and getting into some more communities that would welcome us with our, boutique services. Obviously, we're not for every community, but for those communities that would welcome us, we're taking a look at, maybe opening a shop there. But as of right now, you can access us through telehealthcare.
Well, thank you for sharing all of that helpful information.
Yeah.
That was amazing. So, for question 5 I have down is how do you define the word family?
I really like this one. The world and religion and so many people want to define marriage. People want to define family. People want to define what parenthood is. People also want to define what being a child is and what being an adolescent is. And what Mile High prides itself on is we're not here to preach to you. We're not here to tell you what you should be like as an adolescent. We're not here to tell you what you should be like as a parent, and we're not here to tell you what your family should or shouldn't be. And we're definitely not here to define who you are. So that's been my life work, trying to stay away from defining people. We are alive beings that are fluid and grow in the world and grow in relationships, and we grow as people. And you start defining and narrowing that, you start limiting your ability to grow in self-expression. So we don't define. So family can be what you make your family. I have my biological family that I love. And then I have my family that I grew up with from high school in the 80s that I'm still friends with today, all these years later, that I also define as family. And they're some of the core people in my life. I take it very seriously, teaching my staff and working with our patients at Mile High. Come as you are, come who you are, and we'll see you for that. But we're not here to tell you how to be. So you get to be you, and we'll be us, and we'll hang out together like that. But I'm not here to define anything for you. So I would say that's a big no-no for our organization. We're not here to bust you down or make you sit in a little family box, or if you're a gay guy, you need to act like this. If you're feeling transgendered or moving in a gender affirming way, you have to behave this way. Or if you're a mom, you need to be a soccer mom. we don't do any of that. So I think defining only causes trauma and harm.
Yes, I totally agree on how you said it's what you make your family. Like I came from a very toxic household, and as I got older, I was like, I want to be different. I want to make the life I want to make better for myself than what I had growing up. Like if I ever had children, I don't want them to experience the things I went through. And I really love how you explain, just come as you who you are. Don't be anyone. Like just be yourself, embrace who you are. Like no need to change, no need to pretend you're someone you're not. But I relate to that 100%.
And we work really hard to try to hire staff with that kind of mentality and feeling. Not all of us are raised to be that open. And a lot of us are raised in a very defining world. And we're taught to stay in your lane, and you need to follow your father's footsteps, or your mother's or your grandfather's. And sometimes there's even worse, that we're taught that generational abuses. I was abused by my mother, so therefore I'm abusing you, and you're going to use yours. That's just what our family does. So we don't we like breaking that. We like letting people know that kind of what you just said is, no, I want something different for myself. And everybody has a right to be who they are. Like I said, we're fluid, we're living beings. And you have thoughts, you have emotions, you have feelings, you have desires. And we try to build upon those. And that's what improves your mental health. That's what improves your physical health. And then that's ultimately what improves your relationships with community, your children, your employer. So I really like question 5 about definition. So sorry to get on my soapbox with that, but I take it very personally, and I'm not like some kind of hippie that's out there like, you know, if you don't want to wear your shirt in King Supers, you don't have to wear your shirt in King Supers. I'm talking about, of course, there's still societary norms and rules. I'm really talking about being, paying attention to your soul.
Yes, I totally agree. It's about like just self-love and just embracing yourself, like what you like and what you want to be. I just love how you explain you no need to change yourself for nobody, just be yourself. So for question 6 I have down is what supportive recovery services do you offer there?
Well, we really believe in offering services through lived experience. So what does that look like? People that have gone through the mental health system, that have worked on mental health treatment plans, that are working through medication assisted treatment, that have graduated through all of those processes, have found that sense of peace and trauma reduction. So that wraparound program, when we started this conversation, that was called Transcend. And Transcend is our peer program. And every department, every patient at Mile High Behavioral Healthcare gets assigned to somebody with lived experience. So you get a therapist, you get a case manager, and you get someone with lived experience. So it's a 3-pronged approach is our treatment at Mile High. So you don't just get a therapist, you also get case management support, which is very important part of the process. And most definitely, I think of it like a hamburger, like treatments like the hamburger itself. And I think of recovery supports like the bun, the lettuce, the tomato, or it makes it a complete sandwich. So in my mind, you can't have a great smash burger without a really good bun. And that's the way I look at my recovery support services is they're the bun that holds everything together. And so they're the bun, they're the glue, they're the magic. Clinicians are great. I'm one myself, but sometimes it's much nicer knowing there's someone in the building that has walked in your shoes, and you can go talk with them, and they can just relate a little faster because they've kind of been there, done that, and they can kind of really get to know you in a more personal way quicker. So I think it's a very big added bonus in our organization to have people with lived experience. So they're from mental health to homelessness to recovery to living with HIV. So people with lived experience can come through all of those different ways and offer those supportive services at Mile High. So it's not all just about drugs and alcohol. It's not all just about mental health. It can be from domestic violence to sex addiction to I lived a life being in a gang and selling drugs, but now I want to give back. I'm no longer living that life, and I want to help other young men and women not live that life. So I think our definition of recovery support services is a little broader. A lot of people might think of it more as mental health and substance use. Ours is, it can be really about life recovery.
Yeah, definitely. As a Vista, I have lived experience and I know from like other Vistas as well. And it's like when I come to the drop-in center, there's youth who come in and they explain, they express how they feel. And like I see their emotions and I'm like, wow, like I was once there. Like I have lived experience. Like who am I to judge you? I'm here to help you and walk you along where you need help and support. I'm here to guide you, but also lead you in what you want and reach your goals. So I think that's great.
Not here to help you. I'm here just to sit with you, and maybe next week you come back and you ask for help. But most importantly, what we're talking about is you see them,
Yeah.
being seen because you said, I can feel the emotion. And most of our communication as humans is nonverbal. So that you being a Vista and a young person coming in and just seeing around you, getting to see and feel your emotions starts feeling that safety with them. And I'm sure there's somebody in your life that built that trust and that safety with you.
Mhm.
Mm, that's really the beginnings of how we start making positive change is through that human connection.
Yes, definitely. That's how my sightly Carrie Harrison was. I was at first when I first met her, I was in high school and I was like iffy because I went through a lot of counselors and therapy and like therapists, and it took me a long time to come out of my shell. But like now that I'm comfortable, she's just like, "Hey, Audrey, what are you doing?" I'm like, "Carrie, I'm working." I'm like, "Yes, I'm working. I'm here." It's just like she's like that mother and daughter bond that, like, I never had, so it's just nice to have someone who's there, but, like, to talk to? And I really loved how you said, like, the burger, like, how you explained the burger. I really love that because I never thought about something so, like, with food related, but also, like, it makes it so much simpler but easier to understand.
Where the meat is the treatment, just
Yeah.
go to our treatment plan and be with our therapist and go to group and, figure all that out. But the magic to all of it and why I'm so passionate about people with a lived experience is they really put it all together. So I think of it as, I guess my weakness is smash burgers. I'll let it out. So have it. But, I was looking at it one day and I thought to myself, it feels like our treatment concept. And I was looking at it, I'm like, like there's recovery and then there's so, and it just worked in my head. And, when people ask you like, our adolescents are like, what is, why do I want somebody that's like me? Or what does live experience mean? So I came up with this analogy and so many people now say, I rather have bun services than the meat services.
Yes.
So then I say, well, it all goes together. We gotta build burgers. So
Yeah.
it takes a while to build back up. So, well, thanks. I wasn't trying to make it simplistic, but I was trying to make it a user-friendly way of thinking about what your course of treatment could look like.
Yeah, and I'm like, by the end of it, you have this beautiful, beautiful burger, by all the work and effort you did to make it.
And you're ready to take a bite out of that, which is
Yep.
taking a bite out of life and moving on.
Exactly. Awesome. For question 7, I have down is in what ways can others people help support Mile High behavior healthcare?
Yeah, definitely making referrals, knowing people in the community, letting people know by word of mouth, I always think is the best. You certainly know who the flagships are, Denver Health, all of the major behavioral health and hospitals. But, we're this like kind of little diamond that's, I believe, sitting out there. And I think word of mouth and people with lived experience and people that we do official graduations, by the way. Though many people don't have a chance in their lives that are marginalized to graduate high school, to graduate college, or to have a sense of completion. And you have all these undone things in your life that build up. So at Mile High, when you finish your treatment plan and you're getting ready to like move on, we have an official graduation, cap and gown, music, a diploma, bring your family, it's dressed up. And so many of our people have never had that opportunity. And it's a very special day, actually. So how can people support us? Helping people get to recovery, helping people get to graduation, volunteerism, getting the word out for us, volunteering when we do a call to action, like if we're short on certain clothes items, or right now my food pantries are running low because the federal government has rolled back providing food banks in this current political environment. So our food banks are running low. So definitely helping us when it comes to those call to actions, helping us in our gardens, helping us in our programs. So we welcome community involvement. So there's a lot of different ways you can help, actually.
Yeah. After he was, like, going through the podcast and asking you questions, I've learned so much, like, you can help other towns and people who are in need that don't have you guys with, like, resources down, like, organizations close by that they can go to and contact you, and I'm just like, "Okay," like, I never like, I probably have, but, like, I always thought, like, "Oh, I need to add them because they're in my town," and, but, I can totally add you guys on my community mapping and spread the word out of youth who need that support and help.
Well,
Yeah.
interesting story when you're talking about that. Early on in COVID, when I was supporting my agency I became a clinician again as the leader of the organization. And I try to stay out of that and leave it to professionals. And I'm now the guy that's paying the bills and keeping the doors and lights on. But during COVID, it was all hands on deck. I had an opportunity to work with somebody that reached out, that found us online. And I'll be real careful to describe the area, but it was a young 17-year-old individual that lived close to Oklahoma, like 2 miles away, and in Colorado, and was ready to have a conversation with their parents about that they felt that they were gay and they live on a ranch and they didn't know what that was going to be like. And then COVID hit and the school locked down and they were working with their school counselor and everyone was getting ready to support this young person. And then COVID hit. They found us online. I still happened to answer the phone because things were so desperate during COVID. And I did my first Zoom meeting with this young adult, and I stayed with this young adult for months. And through the story I'm telling you is we ended up, for safety reasons, moving forward for this young adult. And we had a Zoom meeting with the parents in one room, him in another room on Zoom. And we did the whole process through Zoom. And he had the chance to continue to do what he needed to do for himself. So what I'm trying to say is, yeah, I don't think the geographical boundaries would be a boundary for us. So yeah, spread the word is what I'm trying to say. And I'm not going to forget, like, this person said there was absolutely nothing for miles in their community, and the closest mental health center was actually in Oklahoma. So they had to leave Colorado to drive in Oklahoma. And the kid was like, why would I do that? That's not even my state or where I'm from. So I just often think about how many people are out there in the mountain and frontier communities that would like to reach out, especially young people. And, you worry about where they're getting their information too. Everyone's online nowadays and TikTok, and who knows how real some of this stuff is. I watch it too. And I'm like, I'm not so sure putting that on my teeth is going to make them whiter. So I would love if you geo mapped us and spread the word. We definitely want to make sure that we can reach people that want to be reached.
Yeah, totally. I will totally add you guys on my community mapping. So for question 8, I have down is, do you incorporate youth voice in program decisions?
Yes, we do have a YAB, a youth advisory board. They're called YAB.
And
Yeah, so we do. It's not always official. Like you can tell, I don't necessarily like defining and being like very official, and but youth can reach out to me, adults can reach out to me, anyone can reach out to me and discuss programming needs. Youth absolutely in their groups and in their environment in the drop-in center can help guide programming decisions, activity decisions. They helped me design the adolescent center. They helped me design the Hive. They helped me pick out the colors, the furniture. So we are very inclusive as much as we can be. There still are rules with Medicaid and our licensing, obviously, and as therapists, but voice is very important. And if I can't meet your needs, I will be honest and say I can't meet your needs, but I'm going to figure out how to do that and partner with you on figuring out how to help make best decisions for our programs or a program that best meets your needs as well. So we will never leave someone hanging or not listening to them.
yeah, I relate to the youth advisory board as long as having them make the decisions, like having them use their voice and wanting to change the community. Before me, there was a Vista who had a youth advisory board, and there's a crosswalk right outside of our organization, and it's right above, like, the library and a school, and it's, like, right here's houses, and they came up together on how they can make a crosswalk right there, like, for youth and other, like, adults to walk by safely, because there's people who speed by and, they put up all of a sudden, they put up, like, these flags, so, like, there's these safety flags, and it's just incredible because I'm just like, how can, like, these youth and adults come up with these amazing, bright ideas to change the community, but to also make it safe? And they're using their ideas and everything. And I had a question. How many people join your youth advisory board?
Well, it's really patient driven. So it's not like a community driven youth advisory board. Yeah. So everybody has to be a patient. So when it's time to activate the YAB, it's typically, I would say, seasonally because the activities change seasonally. So you would activate your YAB and you want to find out what people want to do during the fall semester, the winter semester, the spring semester, and the summer semester. That all kind of describes what kind of therapy we do, as well as experiential therapy. So I would say we activate ours more in a quarterly process
Yeah.
because we're experiential and you do certain things, pumpkin patches and corn mazes. And, what do you need from us during this part of the season? And that's what guides our decision making. We do the same for the adults.
Wow. I really love the fall one, like, especially like pumpkin patch and all of that. Like, oh my God. I just love fall. I love Halloween. So that's awesome. I really,
The big, I brought it up because it's a very big deal, fantasy for us, because many of our our adolescents are really into color and art. And when you specialize in addictions and people have a lot of different experiences why they were in the height of their addictions, and they're often very creative, smart people and want an outlet. And so that's why we have a music, art therapy, goat yoga, slam poetry. We have adult poetry that come in and talk because we find people to be more creative than not. So when you activate the adult advisory and the youth advisory, it's really about programming. It's really about also how to make it through that season. Some seasons are tough for people, depending on when their abuse happened or not happened, or it's too dark outside and they have seasonal affective disorder. So Our yabs are quarterly, but it's the same for the adults. We get together and really take a look at the seasons and take a look at what that therapeutic process should look like with fall and winter coming and the holidays and yeah, that's how we handle it.
Yeah, that's awesome. Thank you for sharing about that, especially like how you explain it's quarterly as well throughout the seasons. Well, thank you for sharing that, Bob. It was really incredible. For question 9, I have down is what can listeners do today to help the cause of homelessness?
Well, I think what's really important is there is not one pathway to homelessness. And if people could educate themselves to understand it can be because of religious persecution, it could be that the family themselves were underhoused. There might not be stable employment in a house. There could have been an addiction in the house. There could have been multiple births in the house, and you didn't feel that you fit in anymore because there was so many brothers and sisters. So there's so many things that lead to homelessness from mental health to substance use to so many different pathways. And I think it is really important to take a step back from the word of homelessness and take what you think it is and what you think of that person and throw it out. Because generally, if you think this person is homeless because of this reason, 9 times out of 10, you're wrong. And so when you're driving down the street and saying, oh, they're homeless because they drink Colt 45 for the past 20 years. Well, that's not necessarily true. Or they're on meth, or they're on crack, or they're this, that, and the other. So remember, I have a real strong opinion about defining people. So I would say the best thing for the community and the helpers of the world is understand the best you can that there's multiple avenues that lead to being unhoused or needing to leave your environment and become homeless or on the run, so to speak. And to really embrace all of those avenues, you've got to take a step back from judgment.
Yeah. It's like a reference of saying, "Don't judge a book by its cover," because you haven't read the pages of inside, like, what's inside the book, like, how a person's life is and how what they experience, but also why they're doing it, and, like, it's a way of coping with something, like, how they could manage it. That's how my mom was. She was
I
home.
like what you just said. I like the fact, don't judge the book until you read it.
Yeah, It's just like when you read the book, you're like, "Oh, wow, like, I learned so much in this," like, it's like when you watch a movie and it's an hour and something, but then when you read the book, you're like, "Wow, this was much."
I learned a little bit more. Yeah.
Oh, and it's just, like, taking that into consideration of yeah, don't judge anyone for their preference or the way they look or what they do, because there's reasons why, and we don't know why. So, yeah, I I'm just I totally agree with this, like, with what you said and everything.
You got one last question here, and I'm going to quickly answer it since we're out of
Right.
time.
Yes,
What's my definition of recovery?
yes, go for it.
It's your journey. It's not me. It's not mine to define. So recovery is personal, and recovery is your personal journey. And what may keep me in recovery might not keep you in recovery. So I think recovery is your personal book and your personal book to read. And that's getting to know yourself. And it's your journey and your right to recovery and health.
Yes, I totally agree with your journey, making it something beautiful, like, your book may not make sense at first, but it's, like, along when you go with the flow, it comes out beautiful in the end, You can have a plot twist or something, like
Absolutely.
yeah, make it something better. Awesome. Well, I appreciate you doing this podcast with me and taking the time out of your day. This was all beautiful and also like heartwarming questions and resources as well to share out with our podcast. So thank you, Bob.
And thank you for being a great person to be interviewed by. You made it really easy for my first podcast. So I got one under my belt now and you would bring to get me started. So
Thank
thank you.
you.
And I look forward to seeing all the work that you do and the journey that you're on. So certainly keep in touch and Thank you for taking an interest in Mile High today.
Yeah. Thank you.
Peace.
Bye.